primary screening options for women with dense breast tissue, and this is BI-RADS CD. So using mammogram, for example, they're really insufficient at finding the majority of breast cancers with BI-RADS CD classification. And in fact, about 60% of those cancers are actually missed with traditional mammogram. Supplemental screening can help in these women, but it does come with increased false positives. Typically, MRI is the main imaging modality used in this setting. So that results in more tests and potentially out-of-pocket costs for these women. So we've decided to take a new approach and kind of try to take imaging out and provide a blood test as a means to help supplement that process. So we feel our proteomic assay can absolutely help with this because dense breast tissue is more of an imaging limitation than a biological one. And since we're looking at proteins in the blood, we feel we can find those biological signals. So we've published recent data showing that we can identify early stage breast cancers, and this would be stages 0 to 2, independent of breast density with high sensitivity. So we're definitely excited about where proteomics can go in this particular indication, and we feel we're addressing that unmet need. So our study highlights the promise of a simple, accessible blood test. I mean, that's really what it is. So we don't have to use imaging that can perform on both sensitivity and specificity. And this is where we think it's critical because, for MRI, we're on par with sensitivity, but MRI comes with a much reduced specificity. All right, so that can lead to a lot of false positives. We're similar to ultrasound on specificity, but we are far and above the sensitivity of an ultrasound, so we can find more cancers. So we feel like we have the best of both worlds that both of those imaging modalities can't provide. They can provide one, sensitivity or specificity, but they can't provide both. So we feel like we're in a really good place here with the performance of our test. And as our data matures, we feel that we can fit in a post-mammogram to rule out the need for these unnecessary follow-ups with very high confidence, as our negative predictive value is actually quite high. The earlier, the better is always the case. And, so we've always believed at Astron that finding cancer early is the key to improved survival. And this is true for breast cancer, but also for any other cancer that you can imagine. So if you can find it when it's localized, treat it, get rid of it altogether before it has a chance to metastasize, that's really where you're going to get the curative intent for the disease. So stage 0 breast cancer, as you mentioned, it's typically ductal carcinoma in situ or DCIS. And then while not all DCIS cancers end up becoming aggressive, all right, the capability of our test to measure proteins that are suspicious of early stage DCIS points to the sensitivity of our test and how we can find those, I think, is very critical. So this importantly gives women and their providers then the opportunity to make informed decisions because they'll have more information around the status of their disease. So I think we put all that together, that's kind of where this test fits. Early detection tests, they're typically geared towards multi-cancer detection versus just one cancer or another. But if you look at breast and prostate cancer on those tests, the performance at early stage disease is actually quite low. So stage 0 to 2, the sensitivity of those tests, it ranges from not detected at all to about 30 or 40%. So the reason why is breast and prostate cancer in particular, they don't shed DNA into the bloodstream at any high sufficient quantities to be detectable at an early stage disease. So what's happening is that those patients are going in to take a test to measure analytes that just aren't really in high abundance. So you're not able to pick it up, right? No analyte, no detection. So that's why it's been so difficult. This is where we feel proteomics has an advantage because cancer doesn't form in a vacuum. So cancer cells signal to other cells in the body. They signal to immune cells. They signal to stromal cells. These are the supporting cells around the cancer, all right? And that crosstalk and that signaling between those cells is typically done at the protein level. So we can pick those proteins up, and that allows our test to be sensitive at these early stage cancers because we can find those signals and provide that sensitivity that we need to pick up cancer as early as stage 0. We're excited to work with the clinicians in this space, and it's an exciting time right now, both at Astron and with clinicians who are screening women for breast cancer. And we have a few studies that are going on right now. So we did an interim analysis of a prospective study where we showed high sensitivity for early stage 0 to 2 cancers in women undergoing a biopsy for breast cancer. And also this worked very well in women with dense breast tissue. and it had a high negative predictive value. So we're pretty excited about that study. The full results of that study will be reported in probably Q3, Q4 of this year. So right now, though, as we roll out our test as an LDT, it's intended for women following a screening mammography who require additional risk stratification before further imaging. That's in general what the test is designed for. It's most appropriate for women over age 40 with dense breast tissue, so again, BI-RADS C or D, who've had a negative screening mammogram, and then patients with inconclusive or indeterminate mammograms, so this would be BI-RADS 0 or 3, or high-risk patients with negative or equivocal mammograms, and this would be used as part of a high-risk screening rotation, or women with suspicious or positive findings from a mammogram. This would be BI-RADS 3 or 4. So you can see there's a lot of different stratifications and categories where this could fit in for a given patient, but that's really overall kind of what the indication is for our particular test.